If you're interested in longevity, one of the key aspects of it is heart health. And today I'm chatting to a heart consultant about all things to do with heart health, especially if you do endurance sports and how they can relate to longevity. Hope you enjoy it. So today we've got a special guest, which is Dr Critoph from Bournemouth Hospital. Is it Bournemouth University Hospital? Or?
It's University Hospitals Dorset now.
Okay,
yeah.
So yes, he's luckily dropped in to talk about heart health and maybe answer a few questions that you've had about heart health generally in sports. And I take it you are into sort of endurance sports yourself?
All sorts of things. I mean, I've got a lifelong sporting interest and background. I would say I'm one of those people that I'm pretty good at lots of things, but I'm not amazing at anything.
Yeah.
So I do a lot of cycling, weight training, play a lot of golf.
Okay.
These are racket sports. So all sorts of things. But I guess probably some in years gone by I would have been more into competitions, races, that sort of thing. And now. I do it because I enjoy it and I want the health benefits and I want the longevity benefits. That's my background.
Yeah, as we've sort of spoken about off camera, but I know a lot of people who watch the channel are interested in longevity and staying as fit and healthy as you can be for as long as possible. Obviously, there are a few questions around endurance sports. I mean, I know my first question was like the NHS guidance is about 3 hours sort of activity a week, which could range from jogging to quick, fast, brisk walking and things like that. So how does endurance sports, when you might be doing 3, 6, 9, 10, 12, 15 hours a week endurance exercise, is that good? How does that affect our sort of hearts?
Sure. So there's so many different aspects to this. I think it's probably, if we sort of unpack it a bit.
Yeah.
So I guess the first bit of that is why does an individual want to do some training? Because what is healthy or not healthy or risky or not risky will vary enormously across populations. So the answer for a 70-year-old man would be different to a 20-year-old man to a 50-year-old woman. Yeah. So it will vary. And there are some surprising things with respect to coronary disease, so furring up of the heart arteries and endurance athletics, which I'll come on to. But if we to make some generalizations, there is no doubt that exercise in general is pretty much the single best thing one can do to improve your longer term health and well-being.
That's good.
But what that looks like will vary a bit. So if we talk, saying, my personal view on the guidelines, I don't think it's that helpful to say this is the number of hours so for a number of reasons. One, there's no magic number whereby above this it's good and below that is bad. I think it's a big spectrum. The other thing is it doesn't really give any kind of importance to different sorts of exercise.
Yes.
So, zone 2 exercise compared to weight training, compared to HIIT work, VO2 max, all these things are very different.
Yes.
But if we're looking at sort of longevity, it's very clear that a higher peak VO2, so a higher peak oxygen consumption during exercise is associated with longevity. So the higher that is, on average, the longer a person is likely to live. Now, specifically with regards to the amount of exercise, I mean, I think one thing you're alluding to, is it bad to do lots and lots of exercise? And no, not at all.
Right.
But I would, as with a lot of things in medicine, often the main benefit is actually quite near the beginning. So you don't need to do much to get fitter, to get an enormous health benefit. But then that plateaus the longer you go.
Yeah.
And it's actually, it is a little bit of a U-shaped curve, in as much as if you do no exercise at all, you will generally have a bad outcome in terms of health outcomes, heart attack, strokes, dying and so on. But also the very, very extremes probably do actually have some worse outcomes as well. But we're talking, very much at the extreme.
Very extreme.
But there are lots of data in master athletes and lifelong endurance athletes demonstrating beneficial effects throughout life. So I don't think there is a number. And
sounds quite positive then.
Oh, for sure. Well, look,
generally.
I mean, I'm 46 at the time of this recording, and I'm a bit nerdy about all this sort of stuff, and I organise my own
I certainly am too,
training around what I perceive to be the best longer term health benefits.
Right, okay, yeah.
And so what I do now is different even to what I did 5 or 10 years ago, because I'm optimizing my lifestyle to feel better, but mainly from it's incremental gains for the long term.
Yeah.
Now I don't have the time in my week to do 10 hours of biking a week, but I can do other things during my working week to optimize lifestyle.
Well, it sounds quite promising for people who, as I said, obviously a lot of cyclists do cycling as a endurance sport, which means you have to do hours and hours and hours. And
Indeed.
as you alluded to, that the fitter you are, the more you have to do to get fitter. You're always pushing that.
There are
volume.
The benefits at the sort of peaks are less, which is why really elite athletes, you at the top end it's incremental gains which are quite small, and that might be technology or equipment or whatever it is, but they're quite small at that end, whereas the massive benefits at the beginning.
Yes, which is quite nice. It's quite sort of encouraging, isn't it, when in the beginning you start doing sport and you really notice a big difference.
I mean, if you go from the most sedentary fifth, say, of the population to the top 10%, which is actually not that big a jump, unfortunately. And you improve your overall outcomes by tenfold in terms of risk of dying of all causes.
Well, it's certainly nice to nice to hear. The other thing, another question I had was, how hard is too hard? Can there be a too hard? As in, if you're going out and regularly being at threshold heart rate, or being above threshold, or being hitting max heart rate quite often, is that healthy, or is it can you do too much of that sort of exercise?
Okay, so it's probably important to caveat that this isn't medical advice. This is sort of a general advice for general population. But in the main, the best sort of type of exercise in terms of intensity for your longer term outcome is actually more of the zone 2 type exercise. And so people might not be familiar with heart rate zones, but zone 2 is the equivalent. If you're in zone 2, then you could have a conversation. You might be perhaps a little bit breathless and catching your words, but you could comfortably do it for hours on end. And so it's clear that although and myself included, I do find zone 2 a bit boring. I'd much rather the higher end of things. But I force myself to do it. So my zone 2 is about 130 beats per minute, give or take. And so I just try and I use a heart rate monitor, and I will stick at around 130 beats a minute. Now HIIT work, I think, is again depends a bit on age, gender, what you want, what you're after in terms of the benefits. I personally think probably one sort of session a week where you're hitting your peak heart rate is sufficient. And I wouldn't recommend people do lots of those sorts of training, sort of
intervals and things like that.
And I mean, we're talking about ways of training your VO2 max, but I think now clearly if you're on a long ride and there's a hill, then it's quite likely that you'll hit your peak height during that time, and that's fine. But if you're going out to train, then trying to train at a lower intensity, I think is sensible. And it's also fair that the older you get, perhaps the less capacity your body has for those higher end workouts. And that's not to say we shouldn't do them. And I really enjoy them; they're my favourites. But I wouldn't do them all the time. So zone 2 is a good thing for your longevity in terms of long-term outcomes, fitness. That's where to be.
I've noticed that probably doing maybe 2 sessions a week like that, or like a hard ride a week and maybe a turbo session, is probably more, as much as my body can take, I think, of that.
Yeah.
Sort of thing.
I think one hard session a week is I wouldn't personally recommend doing more than that.
Right.
Full stop. Accepting those that you're training for a specific, race or whatever it is. And I think that's a sort of slightly different scenario. But for general,
is it like
health
week in, week out sort of?
Yeah, week in, week out. I think one peak exercise session per week is sufficient.
Okay, but are there risks to doing endurance or too much endurance training? Is there susceptibility of the heart maybe to have issues because of that?
Is there a heart risk?
Yeah.
So there's some really interesting data on this actually, and if you look at so we're talking about coronary artery disease, so furring up of the heart arteries and risk of heart attacks or worse and dying of these. There are lots of studies looking at this now, and first of all, your risk of dying during exercise over the age of 35, heart attacks is the commonest thing. That's what will get people. If you look at the under 35s, it's more likely that there's an inherited heart disease of some sort.
Okay.
And we can perhaps talk a bit about those, but things like hypertrophic cardiomyopathy, dilated cardiomyopathy. But in the over 35s, it's heart attacks. Now, you might think that someone who's fit and done a lot of athletic endeavours over their life is protected from that and they don't get coronary disease. Yeah. And actually that's not the case at all. Yeah. And it's actually very common that particularly endurance athletes get coronary artery disease.
Right.
So you might think, well, that doesn't sound.
That
doesn't sound great.
What is going on there?
But there's a very important point here. So although they get more coronary disease, the event rate, so the rate at which they die or have heart attacks, is lower.
Right.
So there's a bit of a paradox there.
Okay.
And so there's lots of different sort of things. Why do endurance athletes get coronary disease? There's lots of different sort of putative causes. Chronic inflammation, chronic stress, altered blood flow down the coronary arteries during exercise, hormones, nutrition. There's a whole bunch of different things in there. But it's very clear that people do get coronary disease. And if you look at elite athletes, actually over the age of 55, the percentage that will have any coronary disease, about 1 in 2, half of people over the age of 55, if you look, will have evidence of coronary disease on a CT.
Right.
And actually a fifth of those will have what we would count as quite significant coronary disease.
Right, okay.
So quite, slightly worrying numbers. Yeah. So, which I think touches on, so what is safe, what is not, and there are some guidelines that sort of start to be developed, but you can imagine it's a bit of a sort of niche area.
Yes, yeah, very much so.
I mean, I have a sort of personal interest from a sports background, but as a cardiologist as well, and so I'm quite interested in this. And I guess this is then, well, we'll perhaps come on to it in a second, but what can one do to protect yourself?
Yes.
But before that is, well, what is there guidelines on pre-participation screening? I get quite a few people coming to see me to say, oh, I want to do a couch to 5K, or I want to do a marathon and everything in between. Am I safe to do it?
Yeah, very sensible.
And this will, that decision-making process has to be on a few things. So firstly, what is that person's pre-test probability of heart disease? So do they have a family history? Are they diabetic? Do they smoke? Have they got raised cholesterol, raised blood pressure? Are they overweight? And you sort of, so think about those things in terms of a pre-test probability. And if one and so there are some scoring systems and so on, but if your pre-test probability of a heart attack or stroke at 10 years is very low, so less than 5%, then the guidelines as they are currently would say you don't need any pre-participation screening.
Right, okay, yeah.
And this pre-participation, this could be I exercise anyway and I just want to know if I'm safe or not. Having said that, it's pretty hard as an adult to get your risk that low. I mean, I'm as healthy as you like, have no symptoms, and mine comes out about, I forget exactly, but let's say it's 3.5%.
Right.
The point being, as soon as you get into your 50s, your risk increases because age is the single biggest predictor of risk, bar none. So you could have an 80-year-old who is, to all intents and purposes, very healthy, but using a scoring system, their risk will come out higher than a 50-year-old man who smokes, is diabetic, and so on, which I don't think, and this underlines in my view, sort of fallibilities of a scoring system. So let's say we have a person who, mid-50s, mid-60s, something like that. The pretest probability is, not nothing, but it's not super high. They're fairly healthy, but they want to do or are doing endurance athletics or some sort of sport. We will then think, well, what sort of testing is available to better inform the decision for on recommendations. Yes. And so these days, where the data isn't, in terms of what I mentioned earlier about how do we know people have got coronary disease, it's CT scans. Right, so there are studies doing CT scans. So this is a non-invasive test. You get an image of your heart arteries, and it will tell you, do the heart arteries look normal? Right. Is there a little bit of furring up, or is there a lot of furring up? And based on that, you can then make some more personalised recommendations to that individual. Right. And often, particularly in athletes, so this sort of furring up, if you will, comes in two forms broadly. So there's what we call soft plaque, which is soft, and hard plaque, so a bit more robust. And it typically in athletes you see more of the hard plaque. It's got more calcium in the walls of it. So, and the relevance of that is that the general thinking is that plaque is less likely to pop open and cause a heart attack. Right. Because when people have a heart attack, what actually happens is, let's say you have a heart artery that doesn't have much furring up at all, but there is a little bit. And one day if that breaks open, and in the same way that if you cut yourself and you have a clot form on it, you get a scab. But if that clot forms on a heart artery and you have a heart attack, that's serious. And in actual fact, 50% of people drop dead. When you hear of such and such dropped dead out of the blue, had no warning symptoms, that's the mechanism behind it. Right, okay. So a lot of people do not have symptoms beforehand. In fact, if you look at people who have come into hospital with a heart attack, a lot of them, I can't remember the numbers off the top of my head, I think it's sort of 10% or so wouldn't have actually scored very highly on the scoring systems beforehand. So it's a significant proportion of patients. But if you can see any narrowings in it on a CT scan, then you can better inform the person. Yeah,
it's a little bit worrying to think that you just don't know. You're doing sport, thinking you're really fit because you can ride a long way or fast or whatever. Yeah. But there's no, short of having a scan, there's no real way of sort of finding out how badly you might be affected. No, but you can have the knowledge that actually your outcomes are better than if you didn't do exercise. It's this paradox. Yeah. So it is quite funny trying to get your head around that. You're still better off, even though you might be at risk from that. Things that people want to know more about is atrial fibrillation, so irregular heart rhythms. Yeah, well, that was my next question actually, because some of the guys I know have got that. Yeah. What causes that? What sort of risk is it? If you're an endurance athlete, are you at more risk from developing that? So first of all, atrial fibrillation is an irregularity of the heartbeat, and there are lots of different causes of an irregular heartbeat, which we won't go into, but the commonest is atrial fibrillation. So atrial fibrillation is common as you get older. It's commoner with a whole bunch of other things. Weight, so being overweight is one of the primary drivers, but diabetics, high blood pressure and so on will all contribute. In athletes, it's more common, and so particularly endurance athletes. And it's just, again, we're not quite sure the mechanism of that, but there are certainly some what we call remodeling aspects of the heart muscle that can happen with endurance athletics, and I can't help feeling that's part of it. Yeah. And probably also to do with what's called vagal tone. So you might have heard of the vagus nerve, which rest and digest and slows the heart rate down. And athletes will often have a low resting heart rate, which is great, but often a slower heart rate can predispose to atrial fibrillation. Right. It allows more time for those those circuits to develop. So it's very common. I mean, common in the normal population. 1 in 5 patients who are 80 have AF. So very, very common. But it is more common in the athletic world. There are lots of different treatments for it these days. I mean, if you get diagnosed with that, are you a much higher risk then from having a a bigger issue, or like a heart attack? Or...
Well, so it has no necessarily bearing on heart attack risk.
Right,
it's stroke risk is the issue.
Oh, okay.
And that risk also depends on a bunch of other things. So your age, whether you've got high blood pressure, if your heart looks structurally normal, your gender has a bit of an influence, whether you've had a stroke before. So there's a bunch of different bits that make up your risk. But it's, so for example, if I got atrial fibrillation, I'm in my 40s, I don't have other heart problems, my risk would actually be pretty low. But, a 70-year-old man with diabetes would be a very different story. But that risk can be very well treated and mitigated with blood thinners.
One of the things, it's just, personal to me, so I don't know if anyone else would be interested in that, but my resting heart rate used to be around sort of 49, 50, and over the last, few years it's actually come up a bit. And I don't think I'm less fit particularly, but I have had, I had COVID a couple of times, and I had ever since I seem to get a chest infection every winter that sort of knocks my fitness back a lot. But I don't know can that have any sort of long-lasting effect on heart health?
Firstly, I wouldn't place too much importance on what someone's resting heart rate is. Sure, if it's low and someone's trained, then it's a reflection of that. But if it goes up a bit off baseline, typically it doesn't really. There is a big range, and it doesn't mean either at the resting or even peak heart rates. There's no necessary correlation with fitness or ability or anything like that. Even some elite athletes, actually their peak heart rate is a lot lower than you would expect. So it doesn't always follow. Things like viruses, in particular COVID, can certainly increase resting heart rate. Now, whether that becomes a long-term thing,
mine certainly did when I had it.
But certainly on my heart rate tracker, it's interesting how, I don't really get colds very often, but when I have had them, I've noticed there is a temporary increase.
I often seem to, as soon as I've got a chest infection, it's like, oh crikey. But if it hopefully it isn't a long-term thing, so it should be.
But even if it is, does it matter?
Well,
probably not. If you've had a chest infection or had a viral infection or been otherwise unwell, I think it's sensible to lay off exercise for a bit after that, because there is the reason for that is there is a risk of what we call myocarditis, which is sort of inflammation of the heart. Can be related to the virus itself, or can be the body's response to that virus. People that are having chest discomfort, the message has always got to be get yourself checked out, and that probably should involve a CT. The other thing is we haven't really touched on is sort of stress testing, VO2 testing. So that's something that I think is really useful. So VO2 testing can be done in a number of different ways, but basically you're looking at, it's the gold standard of an assessment as to how fit someone is, but we do also use it to differentiate between different causes of breathlessness. So if you've got someone who's not sure if it's a heart problem or a lung problem, it can be a very useful test. Often done on a bike, can be done on a treadmill, although a bit more fiddly sometimes on a treadmill. But basically you're wearing a tight-fitting mask, measuring the oxygen in and carbon dioxide out, and we get a whole bunch of metrics from that. VO2 or VO2 max is a sort of thing you might, that typically people will be familiar with. And as we've said, is correlated with longevity, bragging rights maybe against other people in the cycling group. But it's trainable, there is a degree of, you can train it to become better. We can access that actually a hell of a lot more cheaply than we used to, and very convenient. So
well, that sounds good.
I'll give you some
be quite interested in that personally, but like you say, there's quite a few people locally who watch, and hopefully they may be interested in doing that too. Brilliant. Okay, well, thank you very much for coming by. I don't know if there was anything else you thought that was very useful pertaining to like heart health and cycling or anything, or endurance sports. Or
one thing we haven't covered, which I think is really important, is what other non-endurance type sport can you do to help your longevity? And so that is weight training. Weight training is really important for a number of things. Reduces the risk of heart disease, dementia, cancer, stroke, you name it. It's really important. And it's something that's often overlooked, particularly in endurance athlete types. Not at elite levels, but at amateur levels, it's overlooked. And often these people will be strong generally by virtue of the stuff they do, but that's a very different thing to specifically training that the musculoskeletal system.
Yeah.
And I mean, I've been to the gym since I was a teenager, but the way I do it has changed over the years.
Okay.
And now the program I do is, you know, and I do mix up and I sort of design my own stuff, but specifically for the longer term gains.
Okay.
I mean, I'm, you know, in my 20s I was more bothered about being big, and I'm
probably we all were
less bothered about that now, and more about the, you know, longer term. But it's something that I think people generally know, I should be active, I should do this, and I do a bit of, you know, whatever it is, tennis, cycling, swimming, but being able to, you know, do those gym workouts, or not saying in the gym, but workouts, so important. It's related to your whole body health. And in fact, interesting, so this you mentioned earlier about, you know, is it gains that can be made later in life? This weight training is one of the places where you can make the most gains, and there's studies even in women in their 90s showing cross-sectional imaging of thighs improving with this. And so if you're looking at, well, from a cycling perspective, you know, it doesn't, squats, deadlifts, reverse lunges, that sort of stuff will be great for cycling. I mean, it's, you know, obviously it's building up your core muscles, but so there's nothing specifically with regard to doing weights and your heart in terms of adaptation, whatever. But in terms of overall longevity and health and well-being,
muscle loss, fighting muscle loss.
So we all lose muscle mass. I mean, after about the age of 38, you're on a downward trend. There's just no getting away from it. But the rate at which you lose muscle mass can be arrested.
I personally don't want to just be fit. I want to be fit and, you know, and able to, like you say, do things, pick things up, move around, you know, get out of the chair when I'm 80.
A few other bits and pieces in sort of no particular order, but I think consistency is really important. That's one thing I think people get wrong sometimes. They'll smash it out in the gym or bike, whatever, but then not do anything for ages afterwards. I would much, much rather my patients do a little bit regularly, and it doesn't need to be a lot, but a little bit regularly than, you know, one really hard effort and then nothing for a while. You know, I have this sort of rule where I'm allowed one day off, but I have it never miss twice is the thing I have in my head. Because, and that doesn't necessarily need to be a ride or a workout, whatever. It could be a Pilates or whatever. But,
just doing something.
But I can't do. I don't allow myself to go 2 days. So if one day you really don't feel, you know, we have days where we can't be bothered. That's fine. But on the second day, if you can't be bothered, I just force myself to do something. And the other thing is about this perception that, oh, well, I lead an active lifestyle. I'm always busy. I'm doing this, that, the other. Surely that's enough. And I sort of feel a bit bad saying it. But for me, that's just existing. That is not. There's no health gains to that, bar being completely the opposite of being completely sedentary. It is really that, you know, consistently doing, you know, zone 2,
something above the usual.
And the last thing that just popped into my head, and so I have my own blog via my website, and
we'll drop that in
the
week. Comments down the bottom, so hopefully people can find it.
No problem. I did a video just a few days ago. There was a study looking at flossing, teeth flossing, and reducing the risk of atrial fibrillation, which I thought was quite interesting. Really? So there's a lot of stuff on dental health and overall well-being. So over and above going to the dentist and brushing your teeth, flossing actually appears to have a good benefit in reducing that. Yeah, brilliant. Thank you very much, Chris, for coming in and having that chat. And hopefully people who are watching, hopefully you've enjoyed it. If you've got any comments, if you drop them down below, and if you've got any questions, I might be able to pass them on to Chris to see if you can answer them at some point, but we'll see. Okay, thank you very much. Thank you. Bye for now. Bye.